We will officially get this event, this very special event today underway. I'm Jamie Zimmerman Sensei. I'm out here in Lake Tahoe, California. I feel very fortunate to be here. And I am one of the members of our Solstice Seminars, Aikido Solstice Seminars organizing committee, and we've organized this special event today. So first of all, just welcome to every one of you for coming. It is a very hot topic, a very pertinent topic, COVID, what now? And we've posed it as a question because we're all in questions, are we not? There are just so many questions about COVID itself and so many questions about what do we do? What do we do with our dojos? Open, close, how do we open? How do we know? And we have so many considerations. Obviously, the very top foremost one is health and safety considerations. And there are clearly financial aspects, so many questions, and that's really what we're here for. To that end, we've assembled just an amazing group of experts, medical experts, as well as business experts, and including a virologist to help us to go through these questions. And so what we're gonna do today is have our panel discussion for just about an hour, and then we'll break into breakout groups. So everyone will have a chance to talk with others, with colleagues and peers about your dojo, your own situation, and get ideas and express your concerns and get support, because I think we all need that. And we've given a fair amount of time for that, half an hour. And when we get there, we'll give you a little more information about that. And then we'll come back together and share from our groups, and also have a chance to ask any further questions with of the panelists. So that's the plan for today. It's a 2-hour session. And again, we just really thank you for being here. Most of you are probably familiar with Zoom. If you're not, there's the chat function. And we really encourage you to use the chat. So type in there comments, thoughts that are coming to you as you're listening to the panelists, also your questions. And we will be sort of culling those and being able to present some of those to the panelists a little bit later on. So that's how that works. And I want to introduce our Solstice Committee. We organized our first big seminar that was in June. Those recordings, we'll let you know that later, but they're all available now of the classes and the panels from that big, wonderful event. And they're all available on our YouTube channel. So with that, I just want to introduce our committee members. First is Janice Tato Sensei, and she's the dojo-cho at the Aikido Center of Dover. She's also one of our panelists. You'll hear about her. She's a pediatrician. Welcome, Janice.
Hi.
Just wave so we know who you are.
Here I am, in my truck.
Excellent, good. We have Lisa Klein Sensei, and she's the dojo-cho at New Haven Aikikai. She is also going to moderate our panel today. We have Melissa Bell Sensei. She's a dojo-cho at Sarasota Budokan.
Hi, everybody.
Welcome. And Mallory Graham Sensei is not here because she has closed her dojo, and they're working on some of those final move out, packing up and moving out today, but she certainly sends her best. Sam Tato Sensei is not able to be with us today. She's also one of our organizing committee members, and Wendy Whited Sensei. So what else do I want to say by way of introductions? I hope you enjoy today. I know you're all here to engage, and we're here from around the world. This is a worldwide global pandemic, so it's an Aikido's worldwide, which is wonderful, but the questions and the concerns are also worldwide. So with that, I also want to, by the way, thank our tech assistants, Lady Nizama and Valerie Smith. So thank you very much for being here today. It's really a big help.
Thank you.
Yeah. Okay. With that, I want to turn this over to our moderator, Lisa Klein Sensei, and she will be introducing our panelists and get things going.
My name is Lisa Klein. I'm the dojo-cho of New Haven Aikikai in New Haven, Connecticut. And part of the reason why I wanted to be a moderator today is because my dojo has reopened. I mean, Connecticut is one of the few states where infections are very low, but I'm still dealing with questions of how much should I reopen? Should I be teaching kids? Should I be keeping an eye on statistics? I mean, Connecticut is doing well, but we're also surrounded by some states that aren't doing so well. So I think it's a very timely topic, and we had a great discussion last time, and I'm looking forward to continuing it. So I'll start by introducing our panelists. So Gina Zerilli Sensei, she started Aikido in 1975 at New York Aikikai with Yoshimitsu Yamada Sensei, and she started teaching at the dojo in 1979. She's promoted to 6th Dan in 2004 and holds the title of Shidoin, or Master Teacher. She traveled the world to train with Yamada and Sagano Senseis of New York Aikikai and also with Tamura Sensei of France, Tanai Sensei, and Chiba Sensei. So she continues to train and teach Aikido and works as a palliative care physician on Long Island with a background in pulmonary and critical care. And she's really on the front lines. Okay, next is Dina Drake Sensei. She started Aikido probably 1,000 years ago with Chiba Sensei. And she's the chief instructor of San Diego Aikikai. And she's also is it APRN, Advanced Practice? Dina, yeah?
That's good enough, Lisa.
Okay.
Good enough.
She's a big time nurse practitioner, doctor in San Diego. So she's also on the front lines doing care of COVID patients, it looks like, as we speak. Then we also have Cecilia Ramos Sensei. She's chief instructor of Grass Valley Aikikai in California. She holds the rank of 6th and is fully certified as an instructor by Mirankai North America. And she studied the art of Aikido as a student of Chiba Sensei, who was a direct student of the founder of Aikido. She worked as an emergency room nurse for many years. Okay. So actually, let's not do a spotlight. Let's keep it on the, just so everybody can see everyone. Okay, and then we have Josephine Fan Sensei. She runs Long Island Aikikai with her husband, Adam Philipshin. And Long Island Aikikai is one of the oldest Aikido schools in the continental US under chief instructor Eddie Hagihara, one of the original founding members of the New York Aikikai. She has degrees in business, psychology, Eastern philosophy, and applied health sciences. So Fan Sensei focuses on improving the customer experience, content creation and marketing, and optimizing the operations and finance portions of running successful small businesses, including dojos. So Josephine logs these processes on dojo-cho.com, a free resource hub for dojos. Okay, and then last we have Janice Tatel Sensei. She is a chief instructor of Aikido Center of Dover, and she is also a pediatrician in practice in New Jersey, in Dover, New Jersey. So let's just get started. So maybe Janice, if you want to, oh, actually Amy, I forgot to introduce you, Amy, sorry. So Amy Weiner, she's also on our panel. She's a PhD scientist who worked in the fields of virology, vaccinology, and drug discovery for over 30 years. Amy retired in 2019 after working at the Bill and Melinda Gates Foundation for 8 years on vaccines for the developing world. Okay, so actually maybe we should start with Amy as a virologist. Just Amy, what are some of your observations on the trends in the pandemic right now, and how you think they should be impacting Aikido dojos? So go ahead.
Right. I would say I would like to paraphrase what Dr. Fauci has been saying in the news, Anthony Fauci, the head of the NAAID. And I find him a very reliable source of information. I know him personally. I've worked with him. I've worked with his team. And if you read the news, for example, I would say he's a trusted source. I wouldn't say that about everyone necessarily that is interviewed, but and what I hear from him and what I observe and think of being a virologist, I actually worked on SARS-CoV-1 many years ago as well, is that although there are places with low incidence, there are many places in the United States with high incidence or seroprevalence. And as a result, unless you know very well the people you're working with and have taken many precautions, it is difficult to know who is at risk, because there are cofactors and risk factors that are known and those that are not known. And also it is difficult to know who is a spreader because not everybody spreads the virus equally. And although we don't know what the infectivity of the virus is in terms of exactly how many particles it takes to infect a person, we do know that some people are better spreaders than others. So given all those unknowns, and given the high incidence in many parts of the United States and we have no travel restrictions between states, and you don't know who walks into your dojo, who their contacts have been, even children, especially as maybe children going back to school, I think we're in a very high risk environment, even in low incidence areas. So it really, I think, because there are not wonderful quantitative metrics to understand this pandemic, it really comes down in part to an ethical issue as to when I think a school is willing to open. But right now, I think even though there's low incidence areas, I think we're in a high risk environment. That would be my overall viewpoint.
All right. Oh, yes. And actually, just wanted to introduce one more person, Dr. Marta Crispins from Vanderbilt University. She also is a physician who's been working right now during this pandemic. So, and she's also an Aikido teacher. So welcome, Dr. Crispins. Right. So yeah, so maybe we should go on to Dina. So Dina is actually seeing a lot of COVID patients in her hospital. And I'm just wondering what you're seeing now, what's new. Do you feel any better about the trajectory of the pandemic right now?
Hopefully you can hear me through my mask. I'd say, no, I don't feel any better. Maybe you can see by my face that I don't look any better either than I did during our last panel. So we continue to have community outbreaks here in San Diego County. Unfortunately, San Diego County decided to leave its beaches open for the 4th of July weekend. So we had people coming from the hot spots of Arizona and LA County down to enjoy the 4th of July, lovely weather on our beaches. And we have seen a not surprising uptick in hospital admissions, and our positivity rate here is very high. We still have issues with our neighbors to the south. We have many people who have either decided to retire to Mexico due to the cost of living being so much lower there, and who are coming back seeking care. The Mexican hospitals are still pretty overwhelmed. So we get a lot of transfers from the border. I just opened up outside classes last weekend and got to see quite a few of my members. Didn't train with any of them, of course, because I'm in and out of COVID rooms all the time. And I figure I'm the last person that should be having any contact with anybody. I'm not very comfortable with the idea of doing in-person classes in my dojo, and I'm seriously considering letting that space go, because I don't foresee us being through this pandemic before the end of the year, early next year.
All right, well, I just wanted to turn to Gina Zerilli, Dr. Gina Zerilli. One thing people I think are a little unsure about is it seems like the fatality level is lower than it was initially in New York and the tri-state area when the pandemic was peaking. I mean, do you think, should we be taking it any less seriously, considering that I think different populations are being affected and treatments have improved? So.
Absolutely do not take it less seriously. I'm going to echo what Amy and Dina already said. Even though the death rate is better, it's beginning to increase again. And it's partially better because we've learned more how to treat it. We're a little bit better, but we certainly, have a long way to go. And, you know, until there's an effective vaccine that people are willing to take, and until there's, you know, proven drugs that really can alter the course, you know, in a more profound way than we have already, I don't think we can relax at all. Even states like even Connecticut that was doing so well is slightly increasing. We're much better here on Long Island, certainly than we were. Now I would say now that the adrenaline rush is gone, there's a whole lot of, you know, I don't want to belittle the term post-traumatic stress, but there's a lot of stress that is showing up now that, you know, now that you have time to think about it and kind of deal with what happened was horrible. And maybe that's exactly what Dina's going through right now. But, you know, what I went through in my hospital and what other people are going through and have been through is really very, very intense, and feelings of hopelessness and, you know, inability to fix things, and, you know, just very intense. People dying, families unable to see them, FaceTime end of life conversations, just, you know, really big. And I don't think, even though we got things better in certain states, mostly in the Northeast, I don't really see that we should relax at all. And I think even just a little bit that we've already relaxed, we will see you know, an uptick from that. So sorry to be a downer, but.
All right, let's turn to Cecilia Sensei. I really thought of her as being a good person for this panel because she made the decision quite early to move to outdoor training. So I'm just wondering, Sensei, from your perspective as both a medical professional and an Aikido teacher, what brought about that decision, and how do you feel about it now in light of what's happening in California?
We were in March still training inside, and somewhere in the middle of March, as we're hearing the news, we realized, oh, we should go outdoors. So we had a good parking lot, so it was easy to do. And then it was a little bit just coincidence that our lease was up to expire. And then by this time it was the end of April, and we had just one more month. And it was really, it just snuck up on us. It just seemed like every day we were like, oh, we can train outside. Oh, we can do this. And all of a sudden it was like, oh, we can't keep this lease going anymore. And why should we pay all this money for a space that we really couldn't use, except people would, you know, sneak in and use the bathroom. So I gave up the lease. And I really have sympathy for Mallory, because it was a lot of work to pack up a dojo. We'd been in that space for 11 years and 10 years in the dojo before that. And it just didn't seem like we had that much stuff, but it all adds up, and it was so much work to get out. So that last month we were outdoors in the parking lot, and now we are a bit nomadic, and we have several different places where we can train. So last week we were in one particular park. Next week we're going to go try a different park. But, you know, even still, it doesn't feel that comfortable. My sense, and I want the other experts on the panel to talk more about this, but my sense is that we're not seeing much transmission outdoors. So of course we're still trying to stay 6 feet apart. I think we're doing a good job of that. We don't usually wear our masks if we are 6 feet apart, but we all have the masks so that if at any point we have to get a little closer, we can put them on real quick. So that's what we're doing. And in terms of Aikido, we just miss it, of course, so much, but yet there is just a wealth of material that can be done spaced out and outdoors. So, well, and it's summer, so we're kind of having a good time. But then we look ahead to winter and think, well, all right, that will be terrible because we won't be able to train any day the weather's bad. Anyway, that's what we're up to.
Yeah, well, I think that's a really good point about being comfortable. I mean, we can still do things, but you know, like and part of the reason I'm really happy Janice Tatel Sensei's on this panel as well is that I'm in an urban area and I've had kids knocking on the door begging for the dojo to reopen because they have nothing to do. They have no school, they're trapped in their houses. It's very hot and they just want to do something. And so I have started doing outdoor classes behind our dojo. But again, I'm not completely comfortable with it. So turning to Dr. Tatel, what am I being reckless and selfish in reopening for kids?
I think outdoors is great. I mean, I think there's, keeping separated. We're training outdoors, separated with masks, and I think that's as close to no risk as you can have. But I'm not comfortable with doing more than that. My dojo and my clinic are in a little town that's very high immigrant population, so we have a lot of essential workers. I'm not on the front lines like Gina and Dina, so you'd think in primary care I'd be seeing less death, okay? Because it's not funneling to me like it is to them. Obviously you go to the hospital, you're gonna see the hospitalized people. But in primary care, I've seen so many families where one or two family members have died and taking care of those kids. So it's not, any kind of abstract thing out there. And our death rate, the number of deaths per capita in our town is twice the rate as the rest of our county. We're in a white upper middle class county and we're this little immigrant town, twice the rate. So New Jersey is past peak, but it's huge. And people in my town, they're not knocking on my door. The kids, they're not letting them go outside, even to play outside very much. They're so paranoid, but the parents are going to work, cleaning up as well as they can, and they're coming home, they're getting sick. I've had newborn babies where the moms had COVID in the hospital, separated from the babies. It's just so much of a really active issue in my town. So my dojo, I closed my dojo March 13th when the schools closed. And I was doing Zoom classes, now I'm doing the outdoor classes. And the attendance has been hit or miss. Today, I think we had a really nice class. I have one guy whose wife won't let him come. I mean, people want to go for zero risk. And that's impossible. It's never going to happen. That doesn't happen with the flu. This is not the flu, but our goal is not zero. Our goal is an acceptable level of risk. Kids are a huge wild card. Keeping kids home obviously is very traumatic for the kids, but the numbers are really, everything's new. I mean, there's no long-term numbers, obviously. There's, showing the kids don't get as sick, but then once we have higher numbers, well, some kids get very sick, but then they get better. But then we don't know if they're going to be having long-term consequences. I have these babies who are born of COVID positive moms. Yeah. They look fine, but I'm going to take an extra good look at them. I don't know if they're going to have, lung disease down the road. I don't expect, but, we don't know any of this. So letting kids in, the studies are showing that kids get COVID from the adults in the household. The kids are not giving COVID to the adults in the household. But maybe that's because the kids aren't going to work. I mean, maybe we're just doing a better job of keeping kids from getting sick in the first place. So there's a huge, I don't know. And if we let kids go to school, because right now, I mean, even the American Academy of Pediatrics is saying, yeah, it's probably a good idea. It's looking like it's not as dangerous as you think. But if they go there and we see problems, we're going to have to be flexible enough to pull back. But we don't want to do that. You don't want to make the mistake and get people sick and then pull back. So, kids, it's really tough. And that's in the school system. But in the dojo, I don't want to let the kids in the dojo. For one thing, it's just not worth the work. It's just like to bring them in there and keep them spread out. And kids clump. I mean, there's no matter your best, do your best. Kids they clump, So I'm planning on being outside for a while. I don't know what that means. We need treatment, vaccines. There's all these unknowns. And I think we just have to accept that, I can't make a plan for 2 months from now, except that I need a plan to make plans. I need plans A, B, C, and D, and then set them in motion. But a timetable of opening is really hard. And I think we should learn to adapt to different weather and be outside for a while. So that's where I am.
That's great. Well, let's turn to Josephine Sensei. She's actually really implemented a really strict infection control protocol in her dojo. So I'm just wondering how it's going, Josephine. Are you relaxing things a bit, or how are student numbers?
So, we lost about, I would say, a quarter to a third of our student base. And, we kind of expected that. So right now, I think we're running 6 full groups of 8 people each. We actually, it might be 5 now, because we had to close down one group because the instructor was not following protocol. And that was one thing that we didn't realize was going to be necessary to do. And, the conversation is always hard, but I expect if we're the ones who are taking the risk of opening a dojo, then all of the instructors should be literally on top of everybody with all of our protocols. And, we gave one warning, didn't follow it. That was it. I was like, we cancel that class because I just can't risk it. Which brought another interesting thing. If you have a lot of instructors, each taking a closed group, you need a way to monitor them. We have like live streaming on it that we check in every so often. And this was set up way before, like the whole thing. But if that is something that you guys plan on doing, you need some way to monitor your instructors. You can't just take it for their word. Like I want to say I trust all of our instructors, and I did. But, like you have a nagging feeling. You're like, okay, you know what? I'm going to still do a check every so often. And we looked in and we were like, oh my God, this is not, it got to the point where I couldn't like justify keeping that class open after 2 strikes. Just wasn't willing to take the risk. So then we had to shift any students who had not shown up into any of the groups that were still open. And then, after a period of time to let them, make sure that they're not symptomatic. And that was about it. And I mean, I'm really strict with it. Like if I see you come in, like Adam, his class, he had a student come in without a mask on. And he said, go outside, put on your mask, come back in. Like, and it takes about 4 to 5 weeks, I would say, for everybody to make it habit where they don't have to think about it. It's just, they just automatically do it. But once you're there, you realize, okay, so it's really not that bad. Like on our end as, like managers and dojo-chos, it's a little bit more difficult to set up all this, but for the students themselves, they acclimate actually pretty quickly. And so that's why we started moving to the next, like, I guess, phase of doing things, which is we can't just maintain. I always say this, if a building or a space is not making you money and not turning a profit, it's just a liability because you are one major emergency away from losing the space. Like that's the reality of small businesses, and that's the reality of like real estate investing, is that if you don't make money from what you're doing, you're just a liability. And I know a lot of Aikidoists tend to be like, oh, you shouldn't make money with Aikido. But to me, I said at the beginning, being financially solvent with doing this is part of my responsibility to my students because I provide that space. And so that's why we started moving. I started, like, I'm sure you guys shared on the Aikido Solstice thing, I'm moving towards how to grow the dojo in the COVID era because our protocols right now, we feel pretty okay with. The only thing is we don't have enough instructors. That each of our groups are closed, so they don't cross-pollinate. So in the event that one group contracts it, I close that group down, but the rest of the dojo doesn't close down. And operations keep going. But I don't have enough instructors for that. So that's one of the barriers that I'm running into. We have a pretty robust teaching staff, but even so, like 6 different classes, if I want to keep on growing, I have a limit. Right now, there's a glass ceiling with COVID. Like there's a glass, like prior to this, I could have grown to whatever, but right now I have a glass ceiling. And that's one of the hardest things that like I'm dealing with right now. But no, we may not even move to hand-to-hand. So we had the idea of moving to hand-to-hand in August if the numbers look good. Right now I actually came onto this panel also because I wanted to ask some of like the virologists and, like medical staff, like for me, I had thought of, at 5%, at like a 5% infection rate in the population, we close down the dojo again. At 4%, we move to, you know, outdoor training. At 3%, we move to whatever. Like, but I don't know if that makes sense, or should it be like 3%, 2%, 1%, and then like 0.5, 0.2, 0.1? That would make the most sense to like have a standardized benchmark for when I can move through each of the phases that I had set up for the dojo. So I was hoping somebody could answer that for me.
That's a great question. So I don't know which of the panelists wants to step in. At what point can we resume hand-to-hand training, for example? Would you say at any point right now because of so many uncertainties? Does anyone want to speak up? Raise your hand.
Well,
Go ahead, Amy.
yeah, my opinion is your biggest risk isn't even necessarily the prevalence or incidence in your particular area, but the fact that you don't know what the contacts are of the people who are in the dojo. And because you don't know that, these metrics like the R naught value, which I discussed before, are not perfect. And so, you know, unless you, I mean, I know this is difficult because many, you know, instructors make their living, as you, Lise, and other people on this call. But just from a purely scientific public health perspective, you are taking a risk because unless you have a bubble where you know who all the contacts are for all the people who are entering that dojo, you do not actually know what your risk is. And so those quantitative metrics like the R naught that I mentioned, you know, it's a guideline, but it's an unknown risk. It's an unquantifiable risk right now, and may remain so until the end of the year. I think you have to take it month by month and try to see how the situation evolves in your area and also in the rest of the country, because we don't have travel restrictions. That's my opinion.
Gina. Gina.
I was just gonna say, I agree with everything Amy said. She could just speak for me for the rest of the panel, but
Me too.
we have, yeah, you too, Gina. Yeah. So I would say that we have a group of people in our dojo who are either married or live together or cohabitate or as roommates. And we're lucky that we have about 8 people that are in that situation. And we are teaching some Aikido super spread out in the park, and they can practice together with masks on. And so, but that's not going to be me. And I think it's risky still. And again, I said this in the last panel where we discussed COVID, is like ethically, I feel very uncomfortable with even having this class, to be honest, because literally I just got out of the emergency department where I had a patient dying from COVID, and it was having a really hard time keeping her symptoms well managed. And so she's suffering. And so I can't imagine any of my students or anybody I know going through that. And so I can't imagine myself, and this is really hard for me since I don't think I've had more than a couple of days off practicing in almost 30 years. I don't see myself doing Aikido again until sometime late next year, because it's not going to be about the vaccination, because we see that people are coming back in positive after testing positive and then negative and coming back in with it. So, you know, the antibodies are not, and Amy could probably talk about this more, we're seeing people reinfected. And so we don't know what the vaccinations are going to do. What we need is actual treatments for the disease. And we're a much longer way off from treatment for the disease. What we're doing now is basically palliative as well, right? It just lowers the mortality for some of these patients, but not the long-term sequelae from this disease. So I can't see us doing Aikido grabbing each other, even with a mask on, because I like to think of COVID as a SCD, STD, a socially transmitted disease, sort of like what we used to call other STDs, sexually transmitted. Like Amy was saying, we don't know who's touched who, what contacts they've had. You know, I'm the leader of my community in the dojo, and I have a responsibility for this community and a responsibility for their health and well-being. And you know, they're not going to be training in the dojo again. I'll tell you that anytime soon.
Go ahead,
I
Janice.
think there are two. Can I say two important points that people might not be very aware of? Is for one, the surgical mask is a very important tool, and I'm not saying people shouldn't use them, but you shouldn't be overconfident because they're not N99s, for example. And even an N95 is not an N99, and even N99 is still 1% not perfect. So masks are very important, but social distancing is very important because they are barriers, but they are not perfect barriers. And I won't go into all the aspects of the transmission in terms of aerosols and droplets and all the technical stuff. But that's one important point. The second important point I think to keep in mind is that mortality is not the only important parameter in terms of this pandemic. The morbidity is quite important too. So even people who have mild or maybe moderate or even severe, even if they don't die, there can be consequences, and we don't know what they all are. So those two things are important to keep in mind when you're considering how safe you are in certain environments. I agree with everyone else. The safest is social distancing, mask outside.
Go ahead, Gina. Gina, did you have a comment?
Yeah, I'm kind of saying the same thing. In our hospital, there is someone who actually tested positive in April and is still testing positive up until now. So was there ever a period when he was negative? We don't know because he didn't get tested, but you know, still back in the hospital and still testing positive. Now we don't know how, you know, more than likely because his symptoms are not so severe. He's not that contagious at this point, but you know, there's just so much that we don't know. And in the hospital, you know, to be protected when we're dealing with COVID positive patients, we wear, like generally in my hospital, a gown and then another gown on top, an N95, and then a surgical mask on top, and then a shield on top. And, you know, that's pretty intense. So people may think like, oh, you know, you work in a hospital, I don't really want to come near you. And I don't blame them for thinking that. At the same time, you might have more risk from someone in the grocery store or Costco or Home Depot because you know a whole lot less about where they've been, who they've been in contact with, and how they're protecting themselves. And you know, it's very easy to slip up. We're all trying to be good, you know, but you don't know. There's so many variables, and the consequences can be enormous. Any one of us or someone we know and love can be the one person who gets the disease with dire consequences, or even if, you know, they don't die, as Amy said, the you know, the side effects of their disease can be long lasting and severe and really get in the way of their lives. And
Well, let's ask Dina. Dina Aiki Soul? Are you interested in talking about your experience?
Good afternoon, everyone. My experience.
Can you speak loudly? Can you speak a little louder?
Hi. Can you hear me better now?
Yeah.
Is that better?
Yeah.
Okay. My experience was, as Gina really said, in comparison to people who were in hospitals and ventilators and those things, it was mild, but it was still pretty bad.
We can't hear you too well. I think you need to be closer.
I've got dead spots. Can you hear me now?
Yeah.
Okay. So my experience was kind of rugged. In comparison to other people, it wasn't bad in that I wasn't ventilated or those things, but I still have lingering respiratory and digestive issues around it. And you know, there's nothing they can do because they don't know what to do with it. I'm not showing infection. I have antibodies, but I have impacts or things happening that I didn't have before the first week of March, when I had a completely um, solid physical. My doctor looked, my blood work, everything was fine. And then I got hit with COVID. It took me 2 months to test negative. I tested twice before I tested negative. So my third test was negative, and then the fourth one was the antibodies. So that's pretty much my experience.
Yeah, so you've had ongoing effects. You
Yeah.
don't feel 100%.
It's kind of like you feel 100% because going through it, you're in such pain and discomfort. As soon as that goes away, you feel great. But what happens is, as you begin to move into normal things that require breathing, some kind of endurance or muscular movements, it's not there. The memory is not what it used to be. My short-term memory, I developed this stutter that I can't account for it. So,
Wow.
Before, when I was training, if I was stuttering, I was like, maybe I'm drunk. But I can't, my cognitive skills have been impacted in a way that it wasn't before. And the cognitive, what do you call that? The symptom when I was infected was that I couldn't focus, and I couldn't remember things, and I couldn't discern what time of the day it was. I knew it was daytime, but I didn't know what day it was. I couldn't think straight. My reactions were very extreme. And so there is still a little bit of that, and it's weird. It's weird.
So how do you feel about what we're discussing? I mean, do you think it's not worth the risk of anyone getting infected
No.
to be training?
No, because again, I think because I had such good health before, I got through it between my health and my genetics and a lot of luck. But who wants to be, that person that exposes somebody and that person's experience is completely different or worse?
Yeah.
The tragedy is that people are financially devastated by it, but who in trying to have some kind of social interaction, who wants to be responsible for people, having this kind of experience?
Yeah,
Janice, did you have something to add?
Yeah, I have a few comments. First of all, I agree with everything, Amy and Dina and Gina said. A few things. I don't like wasting brain cells. I have only so many brain cells, so I don't like to waste time thinking about stuff that I can't do anything about. I make a lot of plans and then I put them aside. So now with testing is great for Amy. It's absolutely essential. You need it in the lab, you need it in public health, but to assess the risk of an individual person, it means nothing. I mean, the tests are they're not reliable. We're not doing antibody tests where I am because they're just not reliable enough. And then just kind of for kicks, I tested a couple of kids who had very specific symptoms. At the same time, they had a family member who was positive or died from COVID, and their antibody test came up negative. So, I mean, what does that mean? So, putting a lot of time and thought into what the testing shows is a waste of time, and it's misleading. Also, as far as the statistics, I mean, they're up, they're down. One place is down. You're seeing the graphs, but they're overlapping graphs. I mean, you see something flattening out. Well, New York is doing this and New Jersey's doing that, and you lump them all together, and it gives a very deceptive graph. And then you open up this and that, and people travel, so it all changes. So putting too much on the numbers is not going to help you. I think in order to do, contact training, it's like Dina alluded to, it's got to be really a different disease. I mean, it's not going to be, it's got to be a treatable, preventable disease, actual treatment or vaccine. Either you don't get it, I don't know if a vaccine is going to work on this or not, but treatment. So even if you get it, it doesn't mean what it means now. And until then, whatever the numbers show, I don't think we should be doing, contact training. And the last comment I just want to make, there's so much about the masks. Someone in the chat asked about, the misinformation out there about masks. And as a pediatrician, one thing I say, you can't use a mask on babies, up to 2. And so I'm afraid people might use that to say, see, masks are dangerous. If the baby's going to suffocate, how come you're not suffocating? But the thing is with little kids, it's not that they're suffocating more, if they respond differently to that. That's why babies have SIDS. It's not that they can't lift their head, they just don't. So they respond differently if they start, if they're not breathing well. So that's more the issue, but it doesn't mean that masks are going to suffocate you. And then I see the people on the beaches, some stupid video I saw interviewing people on the beach in Florida, and everybody's healthy. So it looks like, hey, nobody has anything. And I think that's what people see. They see everyone walking around looking fine and healthy, and they don't realize they're not seeing the people who Gina and Dina are taking care of in the hospital. They're not walking on the beach. They're invisible to them. So, you get this illusion of safety, but people absolutely have to wear a mask. You have to, the store, you said, that's a big contact point. We have to wear masks. And, practicing outside, I say 10 feet apart because people drift. So then you stay 6 feet apart, with a mask. But yeah, we can't do contact training. I think it tells a different disease.
Yeah. So I wanted to just bring it back a little. I mean, I know in my own mind, I'm thinking, Aikido is inherently risky. I've seen people get their skulls fractured and their bones broken and terrible concussions. I'm in a violent neighborhood. Somebody got shot around the corner yesterday. So for me, like thinking about in a state with a low incidence rate, I'm almost like, well, it's maybe this isn't, the risk is worth the payout, or I don't know. I don't know if I'm playing silly mental games or what, but I feel like it's not a deadly risk. But so am I wrong? I mean, is something about being involved in Aikido, does that throw off your risk assessment? Does that make sense?
The numbers always lag behind, for one thing. So, the effects of what people are doing now may not show up for another couple of weeks, but the numbers only went down because of our behavior and our changes. They only went down because we isolated and we wore masks and everyone was terrified to go out. Now, I mean, it is hard to stay in that state of panic. And I still say, I remember saying this at the other panel, but unless you've had someone that who's been sick or died, or you yourself have been sick or died, it really feels like it's the other. And it's really hard to keep the urgency about you, but the numbers lag. And, it would be terrible a month from now to realize, that maybe you were too casual. Not you, but one was too casual,
Yeah.
And, Connecticut is already going up a little bit,
Yeah, sorry, Marta, did you have something to add?
Yeah, I want to reemphasize that, right? So look at the South. So you're in Connecticut and New York and New Jersey, where there was a lot of real responsibility around social distancing and getting people to wear masks and do the appropriate things. And look at what is happening in the 18 states in the South.
Yeah.
That are now being told, you guys are going to have to back way off, because what we did was we opened up at Memorial Day. And maybe people talked about masks and maybe people talked about social distancing, but the fact is it wasn't done. And so now Florida is has the fourth largest COVID incidence in the world. It's like the fourth largest country, except it's only a state. We're seeing it in Tennessee. They're seeing it. It's devastating in Houston. It feels like you should be able to relax, and as soon as you let your guard down, that's what happens. It sneaks back in. This isn't something that we can contain by doing something briefly and then going back to our normal activities. We are going to have to maintain this discipline, this really difficult discipline, until we have that vaccine that works, or till we have that treatment that works. And the second thing is, when I go into a dojo and I take risk for myself. Yeah, I know I can have my skull fractured. I've been hit by bokens more than once. I know I can have my neck broken, okay? but that's a risk I'm taking for myself. If you are an asymptomatic carrier walking around, you don't even know how many people you're affecting. You don't even know how many people you may be transmitting this disease to. And, you know, people talk about the moral responsibility. There kind of is a moral responsibility that we have not to put ourselves in situations where we may unwittingly contract the virus and then unwittingly give it to someone else who then has to suffer maybe the rest of their lives with symptoms like we've just heard about or worse.
Point. Well, we just wanted to go to some questions from the chat. So, and then we'll be breaking
Could I
up.
add something before we move on? Could
Sure,
I add
okay.
something that might be helpful?
Quickly, yeah.
So, you know, part of the question is, you know, how long do you think we need to be in this situation where it's very difficult to assess the risk and there's no treatments, as Dina mentioned. I just want to say that one option, one possible treatment that might not be extremely expensive, there will be some clinical trial data coming out in August probably, along the line of plasma injections. Unfortunately, not the purified antibody from the plasma, which would be better, but will potentially come later. But that's, in terms of treatments, that seems like the first one that could, in theory, come along this year, in theory.
All right, that's good to know. All right, so if we have any, Jamie, have you been following the chat as far as questions? So I'll let Jamie go first, and then who was the other person who's going to do that?
Melissa,
Melissa,
yeah.
sorry, go ahead. So go ahead, Jamie, first.
Yeah. Well, first of all, thank you all so much. I think, you know, in some ways we're not really hearing what we want to hear. As we want to train and we want to open our dojos, and right. So, but you know, I think everybody is really making such important points. And there have been a lot of questions and people sharing ideas, which we're going to have a lot more time for in our breakout sessions. A couple questions. One has to do with, do any of you have any real sense or educated idea of when a vaccine might be available? And will it make that the kind of difference that it would need for us to get into physical contact again? And then another question about masks, which is, you know, we're all wearing masks. Is there any mask that's better than another besides, of course, an N95? But, you know, we've all got cloth masks and it's becoming a fashion statement and all of that. But, you know, what do we need to know about wearing masks, the masks we choose, and also how we sort of handle our masks?
Yeah, so let's start with a vaccine. Anyone have any
Yeah.
insight? Amy, go ahead.
I follow that field very closely, so I probably have more information than you want. So I'm going to try to limit what I'm going to tell you. So the first vaccines that are entering phase 3 clinical trials right now, that's the last phase of development before you could get an approval and a commercialization of that product. Three of them are happening right now. And the data for those should be coming out in the fourth quarter of this year. Having said that, again, like what Tony Fauci said, okay, that would give the manufacturers the ability to get a license for that vaccine. That doesn't mean the vaccine is going to be immediately available to you. You have to make hundreds of millions of doses. You have to go through the process of figuring out who gets them first. There was a good article in the New York Times about that recently. For those, and for 2 of the 3, they're a completely new novel vaccine that's never been used in a human before. We have absolutely no idea what the durability of the antibody responses would be, even though right now we think the phase 1 shows that at some doses they might have the right level of antibody that at least protects animals from being infected. So what's the bottom line? The ones in the front, the ones that are going into phase 3, have the data probably by the end of the year. Depending on what that data is, in theory, you could have those vaccines available in 2021. There are others coming behind that are more traditional vaccines, and the whole vaccine industry is progressing at a pace that has never been seen before. That's the amazing thing. But to think that you're going to have a vaccine available to everyone, the average person, assuming you can afford it, I guess, I don't see that happening before the second half of next year, frankly. At a minimum.
You're a buzzkill, Amy.
Yeah.
What's that?
You were a buzzkill, Amy. Look at all the
I'm
gray
really
hair
sorry.
I have. This all just showed up in the last 3 months.
Yeah,
If
so
anybody
how
wants
about
more
masks?
information, I'm happy to provide.
Yeah.
Masks.
Does anyone have any?
So on
any-
masks, yeah, I can definitely. There are
Go ahead.
N99s out there that look usable. Not everybody can wear them. The one thing that I'll say, and then I'll shut up, is that some people are wearing the kind of mask where it's just a plastic sheet, but that exposes the whole bottom part of the face. And if this virus really is transmitted through aerosols, which there are more and more, that's small particles, not the big droplets. If that's really true, that those masks, I think personally, are insufficient. Now I'll be quiet.
Well, and
sorry. Oh, Dina, go ahead.
go ahead.
Well,
No,
so
you.
no, you.
No, you.
No, it does seem that the aerosol spread, which seemed sort of obvious from the beginning, despite everyone saying it wasn't, but poses a huge risk because those teeny particles can go even outdoors. They can fly with the wind a little bit and the breeze. And so when people wear masks, surgical masks are great, but they really have to be worn correctly. It really helps if you pinch that tight over your nose. And they're not 100%. N95s are better, but uncomfortable, and there's less compliance with wearing them. But it is important, whatever mask you wear, that you do make sure to cover your nose and your mouth and pinch it tight over your nose. And they move around as we move, so you have to be vigilant.
All right, I think that's great. And but one thing that someone just brought up is, let's talk a little bit about the decisions to close or open or reopen or reclose a dojo. So maybe Cecilia Sensei, if you could talk about it. I mean, to some of us, it sounds like the end of the world to give up your space. I mean, how do you feel about it? Do you feel it's the responsible decision for some of us who maybe my lease isn't up till November? So go ahead.
I am in agreement with what everybody else has been saying. I don't think that we would be acquiring an indoor space for quite some time till there is a cure or a vaccine or 0 cases anywhere. I don't see it reopening. But on the other hand, I'm totally enjoying being outdoors. I'm sorry if this is jiggling. I got a dog underneath. And there's just so much. There's just such a wealth of material that can be practiced outdoors. So we can do weapons all by yourself. You can do weapons where 2 people are 12 feet apart and one's doing the nage side and one's doing the uke side in sync with each other. That has turned out to be an interesting and enjoyable experience. And we also do body arts in the sense of as if we were doing Tai Chi. So the whole class, I say the whole class, like we have 4 people, but everybody's facing the same direction, going through the nage side of a technique with an invisible partner. And at first I thought it would be boring, but it turns out to be quite interesting, and I've learned a few things from doing it. So other than worrying about the winter weather, I feel like I could be comfortable outdoors indefinitely. And I will not rent another place until all of this is behind us.
And do you think the dojo as a community and Aikido as a community can survive this?
Yes, and I'm particularly struck by something that came out a while ago about the experience of Hambu Dojo during World War II. There was no Aikido being practiced there, what, for 4 years? I'm not sure exactly. So I think that yes, as an art, we are capable of going through this process. I also feel that even though we all miss so much having a partner, but I feel that when we are once again able to have partners, that I will be better for having gone through this period. I'm learning things with this type of training that are new to me after all these years. And I think my students as well, when we can have partners again, their Aikido is going to be better. So I would like to encourage everybody to feel good about being outdoors.
Great. I guess that's a good point to go to breakout rooms. So again, I really encourage everyone to stay and talk, and we'll hopefully have some of the panel members. The panel members will be in among the breakout rooms. And also please take note of questions you may have for the individual panelists when we come back. So we're hoping to come back in half an hour, and any more questions, concerns, debates, please hold on to them for after that point. So we'll hopefully have a wrap up and bring out some more questions. Okay, so shall we breakout room it?
Well, just before we go to the breakouts, we do have one other question, and then I just want to say something as we go to the breakouts. But a question somebody had about contact. Let's say you're outdoors, you're doing weapons training, you've got distance, you've got mask, and you're making contact with your weapons. Is that an issue? How do you handle that?
I think that it's been shown, and Amy, correct me if I'm wrong, but surface contact is less of a big deal than the aerosol and the person to person, hand to hand. So the surface content, depending on what the surface is, it's more or less, but it is really a very small part of the infection process.
And also for us at least, so we're in our dojo's phase 3, which is masked paired weapons training with only one partner. And you guys are, from my understanding at least so far with our masks, we've been operating on the assumption that the mask is not to protect ourselves, it's to protect like everybody else. Right. And so with us, what we do is we have each group, which is of 2 people, each section, every person has their own bleach and water mixture, their own hand sanitizer, and their own paper towels and Clorox wipes. So right after we do the weapons, immediately people spray down their weapons and clean it without having to go to like the bathroom, without having. So I think that might be something, if that's something that you guys are planning on doing, you guys should have some sort of everybody bring their own cleaning solution to immediately like clean all around instead of taking it home, cleaning, or like putting it into your bag, and all that stuff. So I think that's something that you might want to do.
Great.
Well,
Yeah, soap and water is good also. You don't have to have Clorox wipes or something special.
It's just that we don't have we would have to each go into the bathroom, and we want to like limit how,
yeah, I mean, you could have a spray bottle with soap and water in it.
Oh, as in just spray it with soap and water?
Yeah.
Wow, okay.
Good
Wow, I learned
soapy
something.
water
Okay.
solution is good, but also the other, what you use in a BSL-3 would be 10% Clorox.
Okay, wow, okay.
But that has to be made fresh.
Because it's expensive to be buying this stuff that has already had prices jacked up. So, but we were like, we have to, but it's like spending an extra like $70 a month or whatever in order to like refill everything. Because we have 8 spots. Every single spot has their own cleaning solutions. So
10% Clorox, 10% Clorox solution made within a 24-hour period is sufficient. Wouldn't you agree, Janice?
Yeah.
Other people.
Okay.
That's what I use in the
and
lab.
soap and water as well. Like I could just do soap and water, like detergents or
good soapy solution.
But it's slippery.
Surfactants. right. But it's at the end. Like you wipe it off at the end, and you can take it home and like do whatever. If that's okay, then that would be much better for us. I have what is that called? is it surfactant? I have like a giant for like soap making. I don't have it for the dojo. I had it for my own thing. But if that's something that can be used, it's liquid, it's, it's not like, like.
I don't know that particular product, so I wouldn't be willing to say. But I'm saying in the laboratory, that's what you would do.
Let's, Jamie, should we move into the breakout?
Yeah, so we're going to move into our breakout sessions now. Thank you so much, everybody. And with the breakout sessions, you don't have to do anything. We put you in those groups, and we're planning on 4 people per group, and we're going to spread the panelists around and committee members. So, but in each group, if you would, please pick somebody who will be your spokesperson. They may want to take some notes, but we want to share afterwards. Every group, I'm sure, will some different things will come out for each group. So we want to share that, and there will be some time at the end as well to, if we have more questions, and to have panelists respond to some of the things that come out in the groups. If we could put up we have a screen with some questions to think about.
We talked a lot about what our expectations as far as, organizations go, what we would expect from support from them as far as we're going through COVID, because, that's the easiest way to disseminate information if you have a top dissemination thing. And the other thing we talked about was the structure of Zoom classes. What I would have liked to do, because I was with Jacqueline, and she's on board she's on the board of the Norwegian Aikido Federation, and they kind of aggregated all of their Zoom sessions, and I want to know what the data on that is. How has the attendance been? One of the things that I did a anecdotal survey of 20 something people, what they disliked about Zoom was it's very teacher facing. And what value does Zoom bring that they cannot get from YouTube on their own time, for themselves? Because if you can't differentiate yourself from that, then you're going to lose, students, because you're technically not offering any sort of extra value. So it became, we talked about what it means to have a teacher facing Zoom session versus a student facing Zoom session. My husband works distance education, and when you try to translate a classroom environment into an online distance education environment, it doesn't work. It doesn't work because, it's a completely different animal. So that was one of the things we talked about, and about, how to grow the dojo after, or during this entire thing in a safe way.
So we started out talking a lot about how to maintain the energy and, keep things going even though it's distant. And, one person's like, well, there's a sense of community, and that's how people come. But then, also discuss, do we really want to think in terms of continuing versus changing? Maybe it's think of restarting instead. There's something, maybe just give it up and, do what we do, but not try to maintain what was before. Maybe the kids program, kids come and go anyway. I know in my place, I go down, my kids travel and it dips and then it comes right back up again. So instead of trying to maintain the kids program, which is always the bread and butter, you can let that go away and then just restart. And if you don't have rent, you don't need all the income for the kids program. So, just changing mindset possibly, and maybe keep going with the core group instead of really trying to be so actively growing at that time. We agreed to be really ultra cautious inside. And a question that came up is, does anybody know how to have your space, when we do move to inside, how do you have your space evaluated to see if the airflow is you have a good air conditioning system, a bad one? Is the airflow killing you or, helping? I don't know if I assume that there's services that can look at that.
Yeah, there are companies that do that for biosafety containment facilities, for example. But I'm sure there are ones that are less, you can find that are probably less expensive for non-scientific purposes. You probably could find those kinds of places that they can take measurements, they can figure out airflow, they can do all that analysis.
Yeah. Great business opportunity. That's gonna be the new big thing.
I think the EPA at least the New York EPA does something like, or the New York Energy, whatever, they do something like that where they come to your house and they kind of seal, not seal, you seal everything, and then they like have a vacuum and pull to see what it does. But that's mostly for energy efficiency. For our purposes, maybe we're looking for more leakage than.
Well, exactly.
Not.
Just evaluate it to see which way the air is flowing. Is there someone who comes in and tells you, you know, where the flow
They
is?
can make all those measurements. The bigger problem is it's called airflow handling. Airflow handling. If you look that up, you might be able to find that. But the bigger problem is systems that actually either create negative or positive pressure and different airflow and all that. I mean, that can run into some money, so.
Well, it could even just be a yes or no. Like rather than fixing it, just say, how dangerous is my space? To help you with a decision.
Well, so if you look in hospitals, if you look in operating rooms where there's excellent airflow and excellent air handling, right? And we run HEPA filters because we know we're dealing with various pathogens. If we have a COVID case in a room, we have to leave that room empty for 2 hours. So that should give you some idea about how this thing hangs around and what you're talking about with airflow. I don't think you're going to control it during a brief period of time with standard airflow. That's going to be a huge sort of investment that even big buildings are talking about doing in big high-rise buildings and businesses. That's not something that I think is going to be super practical on the individual dojo basis.
Yeah, well, I mean, but
And
some
you can
places
look
they
at
may
an
make.
airplane as an example of that. You're still going to have transmission on an airplane, even though there's a lot of airflow, a lot of turnover. They call it turnover, and also HEPA filters and everything. That's probably not a very practical solution unless you have a lot of almost like an outdoor environment where you have garage doors, on 2 or 3 sides of your space or something like that.
I think you also have the issue of trial and error to get it right. You have error, and you'd hate to maybe make things a little bit worse. You don't know, or just not get it right. Anybody else reporting from the groups?
Yeah, we had a group. I guess we had about three things, and the first one was just really simply, what are some good myth debunking sources, more than the CDC straight information, more than just the straight information from the CDC. Where can we send people to debunk kind of common myths and conspiracy theories? So is there any good recommendation for where to do that? Second thing was, how do we decide whether or not to renew a lease if the lease is up during this kind of shutdown?
Would any of the panelists like to answer that?
How
do you look at your lease?
That's actually what I do. I'm a landlord. So I have 3 properties that I currently rent out. It's like across 7 units. I would say you should have at least a clause in your lease talking about what happens with shutdown. If your landlord cannot provide you with that, don't renew your lease with them. Talk to them about what would happen, say like another lockdown occurs, and have it in writing. Like, I can't stress that enough. Have it in writing that if you plan to renew your lease with them, like what kind of benefits can they offer you for in the event of a lockdown occurring? Because if lockdown occurs, they probably won't be able to rent out to another, business anyways, unless they completely change their model for something else, like if they went from commercial to residential. But you should have it in writing with, like, for example, for me, if I were to do something right now with a lease, it would probably be like, okay, if another lockdown occurs, rent automatically gets dropped to 30% of what you guys were paying. Like, it's just automatic. But you guys have to pay that, or else there's going to be a penalty for breaking that during the lease. This way there's like a compromise, you know, in between. But that's what I would actually recommend. If your landlord can't offer you something like that, don't bother.
Okay, thank you.
That's great. Thank you.
And I was going to
Other
say,
breakout reports?
as far as resources, we're going to post some resources that Amy Sensei has provided and other people can contribute to, some good resources on what's going on.
Great.
Go ahead.
Great.
Actually, I'll just segue to our group with that, because then we were talking about, for example, in Illinois, Jonah Sensei, they've closed their dojo, and physically, with plans to reopen next year whenever the time comes. They definitely plan to reopen, and even if it's kind of starting from scratch again. But I think it was a really important point to keep a consistent path. It's very difficult to open, close, open, close. I mean, just emotionally and schedule-wise, and of course the logistics of having a space or not. So, you know, you really have to look at, can you sustain the rent for a space or not? And maybe really looking at this as a really different period of time. And it's just being very realistic about it, which is what I think we've heard from the medical point of view, is that we need to be realistic. This is with us. It's going to be with us for minimum 6 months, a year, 18 months, you know, it's going to be a while. And so how do we look at this as a period of time and how to best use it in creative ways? And a few creative ways people were talking about was for example, weapons, to look at different weapon systems. You know, there's Kanai Sensei, there's Chiba Sensei, there's Saotomi Sensei, there's Iwama style, there's, I'm not even saying them all, you know, Toyo Sensei, whatever. You know, we can, because of Zoom, we can drop into each other's classes. We can maybe take this as an opportunity to learn some different styles, some different approaches, practice different weapon styles. And of course, just the idea of being creative. I also brought up, I'm on the board of Aikido Extensions. This is a period of time to look at how do we apply Aikido in our lives, in the world, extend Aikido, whether it's in, you know, our professions or our parenting, our education, psychology. It doesn't matter what it is, but as O Sensei said, Aikido is medicine for a sick world, and we literally have a sick world in a pandemic. So maybe this is a time to do some more reading, to watch more movies, to have different kinds of conversations, to really examine. We're looking at taking a deep dive into what's our mission, what's our why are we doing Aikido? What can we really do with Aikido in the world? What did O Sensei want us to do with Aikido in the world? To drop into other dojos, other classes, to bring in guest instructors. A lot of us are, you know, being able to do a Zoom class to another for a dojo that maybe is in a different city, in a different style. There's so many opportunities to, I think we're finding that we're building connections in new ways.
Can I jump on that?
Sure.
I'm completely flummoxed by doing Aikido Zoom classes, as I mentioned in our breakout group, mainly because I don't know how Zoom works. I only am able to do this because Josephine held my hand. But if anyone has any suggestions on types of Zoom classes to do, even if it's just, because I'm thinking of throwing this out to my membership and asking, hey guys, what do you want? What, if we're going to do a Zoom thing, what do you want? Do you want technical? Do you want me to demonstrate falls, techniques, Q&A? Do you want me to give interesting Aikido stories? What can people throw out there for suggestions? And if you want to do this offline and say, do it in a Facebook post later, I'd appreciate that. But any and all input is welcome. Now I'll shut up.
Dave, you hit the nail on the head. You should be surveying your customer base. That period. You should be surveying your customer base. And if you're not doing that, you're just fumbling around in the dark. You know, for us, we found that a hybrid thing where it's you know, if you're to do something like that, it seems like a Zoom session with a archive of videos that they can access on their own time made better headway for them. But a teacher-facing environment for Zoom just didn't really work. That's what we figured out. Teacher-facing environment didn't work. So we have to start looking at all the distance education type research that's out there for you know, for specifically for this. There are distance education stuff for physical education. That is actually a realm of study in like colleges and stuff. So you know, we could probably pull up some resources for that.
Okay.
We have just a few minutes.
Oh, sorry, go ahead.
I just want to say, I'm just very aware of time. So we officially have about 2 minutes left, and we will close officially. We are, anybody who wants to stay, I'm sure, I know I'll stay. A lot of people will stay if our panelists care to stay at all. We certainly respect your time. But
Can I
I
jump
do
in?
want to,
Can I-
we're going to officially close. Could we just put up, and we still have more time, okay? But I just want to respect that and say a couple things. Could we put up our kind of last screen here? Again, I just want to thank our panelists. I think we can all give them a big clap and bow. There was so much amazing information that came out and so many ideas. I hope that the breakout sessions were rewarding and stimulating. You're getting ideas, and we will continue this discussion. We want you to know that this is of course free, but as the Solstice Committee, we are committed to organizing and holding events like this. We will be doing another more seminars, training events, and also these kinds of panels that are innovative, that are inclusive, that are relevant. And we do appreciate your donations. There is some expense in doing this, and it's just an easy tinyurl.com/support solstice. It will take you directly to our contribution page. No requirement to do that, but if you care to, 5, 10, 20, whatever amount you can put in, we really appreciate it, so we can continue to do these things. For the US, tax deductible. We are grateful that we are under the umbrella of Aiki Access, thanks to Janice Tatel Sensei. We also want you to know that there are recordings of all the classes, 15 classes and 3 panels, Aikido and Race, Aikido Principles and Protest, and our original panel that we did at the seminar on Aikido and COVID. All of those are available if you just go to YouTube and search for Aikido Summer Solstice. They are all available, and you can revisit that seminar or visit it for the first time. We had just amazing classes. So we will be doing more events. And again, with your support, we can do more events. So we appreciate that so much. Yeah, you can take that down. Well, if you got that, tinyurl.com/support-solstice. So again, we will make this recording available on our YouTube channel. And I think we should all just say, domo arigato gozaimashita. Thank you. Thank you, Lisa Sensei, for just a wonderful moderation, and to all the panelists. And we're just officially closed, but we are continuing this conversation right now. So we can.
I don't remember the details of what we discussed, but it was wonderful meeting some new people and really enjoyed everybody and having some more input. And the only other thing I want to say is how much we appreciate the Solstice Organization Committee group, whatever it's called, and the development of it. And if something good, one of the few silver linings that came out of the pandemic is this, then I think this is a huge blessing. So thank you for doing this.
Thank you.
Thank you, Sherry.
Yeah.
We had a breakout group also, but to make it short, I think Jamie covered most of the fundamental aspect of the discussion, which is how to introduce creativity into your training. And we talked a lot about kids especially, and how you can integrate story, quizzes, and lots of other creative ways of making your Zoom classes or outdoor training more interesting, and expand your perspective of Aikido. And then lastly, one person said that they'd like to see more international training Zooms in an effort to bring that kind of creativity and cross fertilization into the training.
I'd like to just go a little more on what Dave Norton was talking about also, because we talked about that quite a bit in our group. I didn't get to finish about that. And that is just, it would be really great to get more suggestions about how to keep online training sustainable. Is it the way most of it's being done now doesn't seem sustainable, but those were some great suggestions there. So thank you. Another thing that I'm doing, I've been putting on YouTube classes, which is really a course And as I said, I don't know how much traction it's getting, but you give me an idea. Maybe if I add actual Zoom classes to that, so that those become the basis for a Zoom class, maybe that can work as one other idea.
Excellent. Well, when we are considering some next things we can do, and we may put together just an event like this where people can share their creative ideas, because I think we all stimulate those ideas with each other, and to really get specific, nitty-gritty about them. And we've had a few today. We can maybe have a whole session where we share those, because I think we all want to be creative. We all want to be fresh, and we just get such great ideas. On that note, if you haven't seen the session by Atsiri Sensei during this solstice seminar, please do. Atsiri Servin, and she did a magnificent session where she actually created an uke from a chair and a sweatshirt, and with a head for shomanuchi and arms for all kinds of grabs and ushiros and pins taking down that uke. So that was fantastic to really see. That kind of creativity is just genius, and there's so many things that people are doing, and as time goes on, we have to continue to get more creative and not less. So we will look at doing something like that. Linda Eskin has your hand up. Anybody else with their hand up, please speak.
Yeah, Jamie and everybody, I second what everyone said about this being a tremendous event. Thank you so much for putting it on. In our group, we managed to, we were fortunate to be a very sort of homogenous group. We're all students. We don't run our dojos. We're students at the dojos and at the level where we are occasionally teaching classes. So we had that perspective. We were looking at adapting the curriculum. Like, what can we do that's adaptive? What can we do, not can't we do? And what advantages does it have to train the way that we're training? So we looked a lot at some Zoom things. The big picture things is that this is, as someone just said, a great opportunity for cross-pollination. We're not limited to only our own dojo. I've sort of cobbled together a practice lately, because I'm not going to any in-person things, even in parks, where I have 3 or 4 things I do every week from different dojos that that's been really nice, and we can share those with each other. I can visit your dojo, you can visit mine, we can all train together, which is wonderful. That's a great advantage right now. Something that especially struck us at the level that we're at is this is potentially an opportunity to develop as junior instructors. There's not so much of a limitation about who can teach and how many classes we can have. My teacher has opened up to anyone, any of the instruction staff that wants to take on classes can.
So yeah, it was interesting because Mary and I know each other. Hugh's from the UK, and then we had one more from India. So we discovered that UK is having similar problems as US. It means in terms of the mixed message. It means it's from the top. But I mean, the one thing that so we mostly discuss about Mary's dojo now is doing doing some outdoor weapons classes and still some on Zoom. My dojo is now doing just started Zoom classes last week, and we are the gyms are reopening in Philadelphia coming Monday, so we're hoping, but it's going to be a while before there's any kind of contact. I mean, it's even if we're able to go back in dojo, it's going to be very limited weapons and ukemi in your little space, and that's it. But the other thing too that we also discussed was the long-term, just the long-term effects of the pandemic, as in it's probably going to be a long while before any of us are going to be traveling anywhere for Aikido. Yeah. And as somebody who likes to travel, yeah.
But looking back from a broader perspective, in the last period of time of online discussions like we've had tonight, I've been really deeply impressed by some of the things I've heard and seen. Tonight is one of them, particularly the opening segment where you had all these professionals talking about very important issues regarding COVID-19. My point is to you that this transcends Aikido, and actually in a selfish sense, in the selfish sense of trying to promote Aikido, we should get these messages out there to a very broad community.
Thank you, Hugh, and I would agree with you very much that, and I would like to see that our panel, that first hour, does get out to everybody. The information was just really so profound and so professional, and it's information we all need to have as we're considering whether we're going to school or we're going. It doesn't matter what we're doing in our jobs. It transcends Aikido in that way. And I would also say that Aikido transcends many things in the sense that there's so much that we do that's not necessarily about a kodagaeshi or a nikyo, but the principles and the practices, de-stressing practices, which is what Master Tu was talking about. How do we center? How do we ground? How do we be in balance? How do we keep our mental clarity? How do we have emotional equilibrium? How do we maintain our immune systems and our physical health? How do we maintain connection? These are all things that Aikido is concerned with, that our training is concerned with. So when we talk about extending Aikido, we're really talking about extending these very generic principles, but that we have a way as Aikidoists to talk about and to physically train and to make more than just abstract ideas. And these are things that we so much have to contribute, and that this could keep us very busy and very relevant and very exciting, very meaningful, more than ever during the COVID time, so that it's not separate, and it's not just about how do we keep our usual Aikido practice going. It's how do we apply our Aikido practice to deal with what we are in right now, which is a major, I don't want to call it a battle, I don't like to kind of put it into those terms, but we are really dealing with a major stressor, a major challenge, and on all levels that Aikido has everything to do with. That we can respond as our best selves, our most masterful selves, and that's what we need to be practicing ourselves and sharing it, with our families, with our colleagues, with our coworkers, in every way. Okay, have we heard from? Does anybody have anything they'd like to still share from their group, or anything with the panel? Any last question, or is this a good time to start to wrap up? Lisa Sensei, grab that.
I think, yeah, we can wrap up unless anyone else has anything to add. Again, thank you so much to the panelists, but thank you to everyone. I appreciate your feedback. And yeah, and I was just saying, maybe we can write this up as a sort of a news release and put that out there so people can hear some of the things that we discussed.
I've taken all kinds of notes. I've got 6 pages of notes and thinking about, so we'll work on that. Jana,
reach out beyond the immediate Aikido community and put some of these things out there for other martial arts and other activities, So I think
the panel was truly incredible, and we really want to share that information. Dr. Jana Sensei.
Just one last thought, kind of what was said, but I think this is a great opportunity for people to see what Aikido does. I mean, this is not Aikido, but this is a bunch of Aikido people dealing with this crisis through an Aikido lens and what we've trained to, and for like my CEO to see, this is what we come up with, this is what Aikido people do. It's a great chance for more visibility to non-Aikido people. Also in the training, we're outside, we're in the park, people see us. So it's a great opportunity for visibility. So let's use it. Well, there's Paul.
Along those lines, I've been engaged in a project of simplification. I finally got it down to a brief handout with 5 exercises that people can use, learn from it, and use without any input. So if anybody wants it, I've released a copyright, and if you email me, I'll send you a copy. paullinden@aol.com. And Janice, I was going to send you a copy, and TJ, I just haven't had a chance. Yeah.
Oh, please do.
I will.
Good to see you.
Paul's work, he's so generous with his work, and it's tremendous work. So yeah, I've kind of boiled something down. Do I call it a 7-step body-mind technology? Is how we can, be shift out of a state of stress and reactivity into a state of centered flow. I'm working on a book that. This is a time to write a book, so that's a good thing. These are, really, but all of our basics, it's really our basics, and they're so profound around centering and grounding and uniting and unifying and integrating and breathing and relaxing and connecting These things are huge, and we need to really appreciate that, share that with the world. Thank you again to our panelists and to our moderator. Incredible, just really great. Thanks to everyone for being here and putting in all of your care and your energy. Thanks to our tech assistants. And we will prepare this recording. It will be up on our YouTube channel. We'll be looking at how we can share this information more, what will be a next event that we can continue this. And again, if you can, make a donation. We appreciate it. tinyurl.com/support solstice, tax deductible if you're in America. And yeah, just stay well, stay healthy, stay smart, and make good decisions, and keep it going. Thank you so very much. Thank you.
This was wonderful. Thank you all.
Good.